It's nearly 2026. In 2020, the novel coronavirus SARS-CoV-2, or more commonly known COVID-19, broke out. Many of us were terrified, which is why so many followed the Trump administration's CDC guidelines to wear a mask. For some, this habit followed them into the Biden administration in 2021 and 2022. But it's 2025. It's almost New Year's. There's no way we still have to do that. Or do we? Many may think that the mask-wearing days are behind us, but wearing a well-fitted N95 mask indoors and in outdoor crowds is actually still a good idea. Despite the push for normalcy from regular people, politicians, and influencers online, wearing a mask can be normal, and it can prevent COVID infections as well as long COVID. Though it's not as talked about as it was in the early days of the pandemic, COVID is still a problem. It's still spreading, and while we may consider transmission low between peaks, that kind of transmission would have actually been considered rather high in 2020. Not to mention, COVID still peaks several times a year. By that I mean the transmission levels peak. In summer, after the July 4th holiday kicks off travel, and back to school when kids are back in classrooms, in the holidays when travel again picks back up, and after spring break when people have been on vacation. But taking a break from vacations and looking more at schools, there was a large increase in illness-related school closures in 2021 to 22 and the 2020 to 2021 school years. It's nearly fully attributable to COVID, according to Ziedrat et al. Catching COVID in low transmission is possible. It's not rare. And though many may say that COVID is just like the flu, it's actually not. Most people don't catch the flu every year. And even if you did, you probably don't catch the flu 10 to 15 times in 5 years like some people have with COVID. Aside from that, COVID spreads year-round, while the flu is a traditionally winter-time disease. COVID infections can last up to 2 weeks on average, and for students, this means missed school, difficulty learning, lower test scores, being behind on their assignments, and possibly school closures, which can average around 10 days, again according to Ziedrat et al. 2024. For adults, this means missed wages, missed work, difficulty getting a promotion due to that missed work. And if no work is missed and no school is missed, then that means that the disease spreads even faster to the people of your community. Though variants, that is, different versions of COVID, and people's individuality differ for how they handle COVID, it's not minor for many people. People still die of COVID. People still get very sick with COVID. People still go to the hospital with it. And it's not all about having comorbidities. Having diabetes or smoking doesn't necessarily put you at the highest risk. Though they are a factor, even Olympic-level athletes who are some of the healthiest people on Earth have been knocked flat due to COVID, and not all of them have recovered. But I don't necessarily mean that they died. So what do I mean? Well, that would be due to long COVID. Long COVID are long-lasting symptoms due to COVID, even after a negative test. They're not the active symptoms. There's something that follows you around after catching COVID and after getting over it. There are many symptoms attributed to long COVID, including persistent cough, lung issues or wheezing, gastrointestinal, psychological, neurological issues, POTS or exhaustion and breathlessness from menial tasks like showering or making food, as well as others. Doctors still don't know what causes long COVID, and they don't have a cure either. Comorbidities do not guarantee or disguarantee long COVID. For some, these symptoms can appear and reappear at random, and for others, they're still having those symptoms to this day, even if they caught the disease in 2020. The prevalence of long COVID persisted at 46% at 1 to 2 years, according to a study by Howe et al. Estimates put long COVID at 10% to 30% per infection, not per person. Wearing an N95, though, can indoors and in outdoor crowded areas like concerts can protect you from these risks. It's one of the most feasible and effective ways to avoid a COVID-19 infection, according to a study by Crespo et al. Properly fitted N95 filters and masks filter out 95% of airborne particles. This includes pollution and viruses like the COVID-19 virus. You may be thinking that you can just wear a surgical or a cloth mask, right? But that's not actually the case. Those are more designed to protect against droplet infection, which, despite what we were told in the early pandemic based on limited knowledge, COVID-19 is not a droplet-based virus. Droplets disperse and fall to the ground. However, airborne means that it hangs in the air after being breathed out, sometimes for up to 8 to 12 hours. Greiner-Sparks et al. Note that the COVID virus is not a droplet infection. It's airborne, which means that an N95 mask is necessary. And though you may think, N95s don't really work, I've heard plenty of people say that they're a sham. That's not actually the case. Not only are N95s used in multiple industries that require air filtration, like farmers who are using, I'm sorry, the word is escaping me, like farmers who are using fertilizer, or in biohazard labs, I also have personal experience with them. I've been wearing an N95 mask since 2020, and the only time I caught COVID was when my dad, who works in healthcare, brought it home. After that, I started wearing a mask around him because the risk of a healthcare facility isn't one that I have to face, being as I don't work there. And I never caught it from him again, even when he got sick with it, and he lives in the same house. Furthermore, masking is not a political allegiance. Masking does not mean I'm a Democrat or I'm a Republican. Masking is like wearing this green dress. It's simply a choice that you make. And it's not an insult to others. It doesn't mean that you're saying that somebody else is sick. It's just saying, I'm doing this for myself. COVID still spreads, even in low transmission rates. During peaks, there's an even higher risk. Long COVID is a risk of 10 to 30% per infection, not per person. But an N95 can protect you from that risk. It's a wise choice to avoid 2 weeks of sickness, to avoid spreading it to yourself and your community, and to avoid the personal risk of long COVID. The mask is not a relic of 2020. It is a shield for 2026 and beyond. By more people like you and me wearing a mask out in public, whether indoors or in outdoor crowded spaces, we can limit transmission of COVID and other diseases. Therefore, I encourage you to wear a mask and protect yourself from COVID as well as long COVID risks, and to protect your community and yourself, especially this holiday season with a peak that will be coming due to higher than average travel levels. Thank you and have a nice day. I would like to take a moment to give my verbal citations. This is not speech content, but citations. Centers for Disease Control and Prevention, 2024, COVID-19 related school closures, United States, July 27th, 2020 to July 30th, 2022, and from Emerging Infectious Diseases, Crespo N.C. et al., 2023, Evidence of Face Masks and Masking Policies for the Prevention of SARS-CoV-2 Transmission and COVID-19 in Real-World Settings, a Systematic Literature Review from the International Journal of Environmental Research and Public Health, Greiner-Sparks T. et al., 2024, Masks and Respirators for Prevention of Respiratory Infections, a State of the Science Review from Clinical Microbiology Reviews. How Y et al., 2025, Global Prevalence of Long COVID in Subtypes and Risk Factors, an updated systematic review and meta-analysis from Open Forum Infectious Diseases. And finally, U.S. Food and Drug Administration 2024, N95 respirators, surgical masks, face masks, and barrier face coverings. Thank you so much.